Welcome to season 2 of Dr. G at the Heart of Healthcare. I have Tina Buchanan, MSW, ALCP, the CEO of Visionary Care Consultants here, and we're going to talk about the services she provides to the community. Hello, Tina.
Good morning, Dr. G. Thank you for having me.
Of course. Well, I had so much fun recently. This is a story, guys. We had a wonderful night at my first Padres game. Thank you for hosting that.
It was so fun to have you and for it to be your first game. That was really fun because you were taking it all in and taking pictures of everything and just enjoying the moment. So it was really good to see that.
Yeah, and I'm gonna post a reel of that because it was just fantastic. And I was hanging out with my kids the other day, and they were like, "That's one of the best baseball stadiums in the world." And I was like, "Oh, I didn't even know that," but it was nice.
Yeah, it's
And
fun
you
time.
hosted that. Yeah, you hosted that with another company. Who was that?
Melanie Delgado owns a home care company right at home in El Cajon. So yeah, we did
Okay.
that as our thank you event to give back to our referral partners and our business and relationships. And it's just a good time. Everybody gets to unwind a little bit,
Mhm.
not be so professional all the time.
Right, right. No, it was a great time, and I got a bobblehead. I don't know who was on there, but I hope your kid likes it. I gave it to them because the kids need to get their bobbleheads. Was your kid
Yes, they
happy?
both got bobblehead thanks to Dr. G because someone took my second one and I have two kids. And you were so gracious and you were like, thank you, but please take a picture of them with it. And I still owe you a picture. So
You
sorry
owe me a
about that.
picture. I want to see the
I can get
kids.
it.
I
Yes.
love the kids. All right. Well, let's just talk about you and Visionary Care Consultants. And I am excited to get to know everything you do, but let me just introduce it to the audience. I love how you call it's a call to action. Are you stressed, struggling, and losing sleep over how to care for your aging or disabled loved one and don't know how to successfully navigate a complex medical maze? You have come to the right place. We are your healthcare advocates and care managers of San Diego and Riverside in California. And then you say, we believe everyone deserves to age with dignity and integrity. Amen. That's a great mission. And so I'll have a link to, your website on the show notes, but I want to learn like how you about you, like how you got into this role leading here. I know you were a social worker at skilled nursing facilities, and I'm sure you saw so much there. But just tell our audience like how you came up with this service, and then how do they know when to call you? Like, get down to the nitty gritty of it.
Yeah. Thank you for asking. So, I've always had a calling to help people. And like you said, I worked in skilled nursing in San Diego County. I also did home health care as a social worker. So I saw many things, but I also saw a lot of gaps in our healthcare system. And people would call me all the time after the fact. Hey, remember me? You helped me with my mom. Can you help me again? And I wasn't able to because in working in skilled nursing and home health care, great services that are needed, but they're covered by Medicare. And, it's a system. And so once Medicare services end, these families really have no place to go. There's still a lot of gaps. And I was having people call me because they felt like I did such a great job. And hey, do you have resources for me? And I could send them resources, but I couldn't hold their hand through the process. And I learned very quickly in my roles that unless you're holding someone's hand and being their quarterback, which is what an aging life care professional does, they get lost in the system. They're waiting on hold for Medi-Cal or Medicare. They're being told this and that by this doctor, and they don't know where to go. And so you can give people resources, but you really have to walk them through the process because it's stressful and overwhelming. And so I was like, there has to be a better way. There has to be a profession that does this. And so I started looking up like, how can I help people? What can I do? Is there some sort of consulting out there? And I found out that there was this organization. It used to be called the Association for Geriatric Care Managers. It's now called the Aging Life Care Association. And there's about 500 of us in the county. This is exactly what we do. We are there to advocate for people, to help them navigate the complexities of all these systems. So I was super excited that I didn't have to recreate the wheel because I knew there had to be something already out there. So I became a member of the Aging Life Care Association back in 2018, started my business. And from there, I just went from a team of me to a team of 8. And we're just helping people, navigate these systems that are so complex and so tiresome and so overwhelming for so many people.
That's fantastic. As a hospice physician, I share, we have kindred missions. I have this here to help people navigate the healthcare system because I see the brokenness on that end. And, there's only so much I can do medically, to help people understand the conditions that are affecting them and help them understand the trajectory of the disease. But there's so many, you're the resource expert. I did a podcast on the hospice social worker and all the things that social workers do to help patients and families. But they need that support. And so I'm so happy that there's care managers around to take care of people and hold their hand because it's so important. Um, I want to know, how, like we know that everyone that gets into get the tongue tied. I need my coffee. They get into these healthcare crises, and then they're just scrambling, to try to see where mom is going, where dad is going. And I feel like there should be some kind of roadmap or something to help them, you know, expect it, anticipate it, or put it in their advanced care plan. Like, you have any ideas
Yeah.
on that? Because it seems like they call us too late.
They often do call us too late. We do a lot of crisis management, which we can certainly do, and we're the experts at that. But I try to come from a place of education. I'm sure as a hospice physician, you're educating them on the disease process, on the trajectory, and as the care manager, we're really educating them on, if we had a crystal ball, which we don't, but based on our experiences, this is what we've seen. So we're there to have hard conversations that sometimes I know certain doctors don't want to have those conversations, or the family members don't want to have the conversations. And so we really step up and tell them, like, this is what things are going to cost. This is the trajectory of this choice and this choice, so that they can make those decisions and have the advanced care planning that's appropriate for their financial needs, their family, their religious and spiritual preferences. I mean, there's so much that goes into it than just hey, this is your diagnosis. Here's your doctor. There's so many facets of it that families and patients and clients need to understand. And the healthcare system just doesn't have time to educate them and hold their hand through making numerous decisions.
Yeah, that shows the beauty of an interdisciplinary team, right? Like, we need everyone in their unique
Mhm.
roles to help these patients and families. What I want to understand is, how soon should someone call you? Because I know we're throwing out terms that I want to make sure people are following. Advanced care planning, people know I've talked about that for National Healthcare Decisions Day. Crisis care. We're over here, we're in the hospital, we're in a nursing home. Like, when should someone reach out to visionary care consultants? Is it when they're 50, 60? I mean, tell us about that.
I think it's what's unique about a model like ours is we have solo agers they're the best at planning. Let me tell you, because they have no family, They have no support system. So they find us because they know when a decision needs to be made or when it comes to their healthcare, they have nothing, right? So solo agers are great because they are planning like I they know the inevitable and they know that they don't have children. So they'll come to us in their 50s and 60s. And that's really the sweet spot because then you can plan for the trajectory of how much things are going to cost. What are your wishes? I would say for families, you know, as soon as you see some sort of either decline cognitively, physically, all of a sudden your mom is bouncing in and out of the hospital, and you're spending your days away from work or having to fly back and forth because you're getting a million phone calls a day from your mom, from the neighbor, from the home care company, from the doctor. Most of our clients, they have families, but the families are working families, right? So the kids are the sandwich generation. They are taking care of their elder parents and their kids. And many of them, males or females, they are struggling to meet the needs of their whole family system. And so it's many times our clients are local here in San Diego, and the family members may live on the East Coast or they may live in the Bay Area. And they are having to take time off work and they're literally flying down here every month to check mom's meds or go to the doctor's appointments. That is when you need to find an aging life care professional. Because what I always tell people is the time it takes you to do that and the money that you're spending and the time off work that you have, um, time away from your kids, time is money. And to have boots on the ground here as a quarterback and have that peace of mind is priceless. And so we've seen multiple families really benefit when their loved one lives locally and they're out of town, have that boots on the ground. And we are the communication piece for them. And then they're not getting calls 45 times a day. We're taking those calls for them. And it really gives
Right.
them their life.
Yeah. Yeah. And, we know, caregivers, adult children, you love your parents, your brothers, your sisters, whoever. There's no question of if you have the capacity or will do it, but we I want to provide a resource for you so that it can be more of a smooth road for your loved one, right? Because, I know people, they said, "How can I not take care of my dad after everything he's done for me?" Or "Of course I'll do this." So no one is questioning, your love and your commitment, but you still need to have this type of service available so that we can prevent and avert crises and then have the plan for you. I think that's what the value is. And I say that as someone who sees the end road. And so that's why I do things with Mourning Dove. So again, things can be a little bit smoother because our solo agers, even our people and families with so many resources, it's just, I cringe at some of the things that I have to read and write when I, am doing the CTIs. And I'm like, oh, I wish, things could have been better the last 2 years of life. That's what I call the late stages of life. Like I'll throw that
Yeah.
terminology around. I don't like to say the end of life because people think that's only hospice. That's, oh my gosh, that's when you're going to die. First of all, we know hospice is 6 months or more benefit, 6-month prognosis though. But the late stages of life, it's those 2 to 10 years when things are slowing down, like you said, and people need to make some decisions. Like children, adult children are kind of hesitant, like, oh, my mom won't let me look at her medications. They won't tell me this. And so that's the time to jump in. Do you have any advice to help them um I don't even know how to term it, take control of the situation, because that's often the challenge. The solo agers, I like that term, they're taking care of themselves, but you have adult children watching and their parents and having concerns, but they don't do anything. I have a family friend, his dad just passed away, but he's been talking to me for like 2 or 3 years. I've been sending podcasts, I've been doing things. Things just kind of ended in a crisis. And
Mhm.
how can you, what's your advice to them to get engaged or take control?
Yeah, it's a great question, because it's really difficult. It's you're dealing with a population that is used to being independent. They may have been CEOs, they may have had amazing careers, they may have raised 5 children, which is an amazing career in itself. And when you see them struggling as a family member, it's like, I don't want to go there because I don't want to take away their independence. A lot of times that's a hard conversation to have, but I encourage, and what we tell our families is, just start having conversations early before the crisis occurs about what the wants are, what the needs are, what are your wishes, and just start noticing those signs and breaching the topic early, because once it's in crisis, it's harder to get through to someone. They may not physically be able to meet the demand, they may not cognitively be able to have the conversation. So I always encourage people to start having those conversations early, but it's not easy. There's a lot of family dynamics. A lot of our families have, multiple children who have different ways and beliefs of their own of how mom and dad's end of life should be, or sisters, or, and oftentimes and I think it's nature, we impose our own beliefs of how we want our end of life to go onto our loved ones. And so if you come to a conversation imposing your own belief, it may be hard to um, get them to see a solution, because all they see is, this is your agenda. So it's really coming to a conversation with an understanding that you want to step into their shoes to define what it means for them, because we all inherently do that, right? Like, well, I wouldn't want to live like that, or, you know, my mom doesn't want to go to the hospital 20 times. Maybe she does, maybe she doesn't, maybe she does not, and she wants everything brought in. The other thing I would say is encourage them. If you're having that resistance, this is where I get really passionate about this, because I've seen it so many times. We see time and times again where family members cannot get through the roadblock and have these conversations. But when they reach out to an aging life care professional and they have a neutral third party that can really come in and help the family mediate these conversations, or even meet with the client one-on-one, and then go back to the family with the care plan based on what the aging person or disabled person wants, it really helps them be more cohesive, because they now feel like there's a neutral third party who understands them and hears and wants their wishes to be honored. And so it's not easy. We have lots of complex families, but our end goal is always to advocate for the elder loved one. And so we become their voice if we need to, and their advocate, and we can tell the families, like, you're not hearing what Mrs. Jones is saying. So a lot of times we act as mediators, and it's really fun work, actually, because once you see the system calm down,
Mm.
and people are peaceful, even though they may agree to disagree, you just feel that level of stress going down and down and down. That was a mouthful I just gave you.
No, but I there's gonna be some bullet points in the show notes, and someone else on one of my episodes talked about things coming down, and we who work in this industry, we know what that means, and we know what it feels like, and it's a rewarding
Exactly.
thing. So what I take from that, and I have some notes on that, I've been wanting to do an episode on that. How do you help the senior recognize the limitations of their autonomy? Like they're not hearing their kid. They, like you said, they may hear it from you, but how do they even consent to meeting with you? Those are some of the challenges. And so I think you gave us some advice there. Before we go, because I know you have a busy day of people to take care of, what you said, it reminded me of a situation recently where another care manager is helping a client who's having some legal issues with their children. And so for me, I'm just appalled, like, oh my gosh, wait a minute. Like, so I'm going to help with capacity evaluations and do things like that. How can we protect the seniors when they have their children in different walks of life? Maybe they did their advanced care plan and their estate planning 40 years ago. Now they're in their 90s, and now, their adult children are in conflict or, estranged and things, and there's lawsuits and things like that. I really want to uphold what the senior put in place, and make that, at the forefront. So you have any words about that?
I do, and we do that upon every assessment. We look at that advanced care plan and we look at how long ago was it done, does it need to be updated. If the person has capacity and their wishes remain the same, maybe their medical wishes, but the family complexities have changed, and they are worried that those wishes will not be honored, we always suggest bringing in a professional fiduciary. And we have in our tool belt, that's one of our major resources, is a fiduciary to act as a third party. It doesn't mean the family's not involved. It just protects the senior, and that person can act on behalf of what the trust and what that legal document says. Because at the end of the day, that allows the senior to sit back and feel like, okay, I'm going to be taken care of. My money's going to be spent where I want it to be spent. And sometimes, though, the kids may not like it. At the end of the day, the senior gets to live out their best life with their wishes. So we'll bring in an attorney, we'll bring in a professional fiduciary. And it doesn't mean those people automatically start taking over, but it does mean once that person no longer has capacity, as you know, Dr. G, then someone else can make those decisions for them. And oftentimes, a professional is the best person to make those decisions because there's no emotion in the decisions that they make. It's this is what's documented, this is what they want. And so they're going to honor that. And sometimes with families or even neighbors, or if a caregiver is named as an agent under powers of attorney, they may not make the same decision that they should when it comes down to it because of their own fear or their own guilt for taking them off life support, or making this financial decision over that. So a professional can come in and really protect them. And we talk to our families that are struggling with this, we talk to our clients that are struggling with this, and as long as they have capacity, we encourage them, if you want to make changes now is the time to do it. Because if once you are incapacitated, then you have to go through a conservatorship and there's more legal battles. You don't want that. So we're advocating for that from the beginning so that their wishes are honored and met.
That is fantastic. You nailed it. So I'm going to close us out with what you say on your website, and then I'll have a link to it also. I just thank you so much for your time. It says, at Visionary Care Consultants, we assist you in implementing a care plan for your loved one that fits your family's abilities and resources, give you the medical and community support you deserve, excuse me, and ensure that your loved one does not fall through the cracks. We give you the confidence knowing your loved one has great care and peace of mind knowing a caring professional is by your side to advocate for your loved one. And the services range from 55 to 195 per hour, which is very reasonable because I could buy some shoes, or we go to Costco and spend that, or Target, Amazon. So, our
Yeah.
families, our life is worth it, our quality of life. And so I'm so glad that I met you a second time. I know we first met at Brenda Lee's Christmas party, and then I had that time, but there was definitely an alignment of my mission and your mission. And I'm so glad that we can work together serving the community.
Yes, thank you for having me and educating your online community about certain things in this space because it's so important. So it's all about education and collaboration. So thank you again. Have a wonderful day.
All right. Peace, everyone. Signing out.
Peace.